Welcome. Today we're going to talk about the cardiovascular system. So it's one of those systems in your body, along with many other systems like the skeletal system, like we talked about the last day. So first of all, what is the cardiovascular system? Well, it is the body's transportation network. It transports nutrients to your cells like oxygen, and it removes waste products like carbon dioxide and so on. So the cardiovascular system consists of three main components. We have the heart itself, we've got the blood, and we've got your blood vessels too. We'll just start with the heart. So your heart is a hollow red organ, and it's about the size of your fist, and it sits at the centre of your thorax. It's made up of four chambers, two chambers on top and two chambers at the bottom. The ones on top are known as the atria, and the chambers at the bottom are known as the ventricles. The heart wall itself, the outer wall, has got three layers, and the middle layer being the myocardium, which is cardiac muscle. It is controlled by the autonomic nervous system, so you don't control your heart rate. When you exercise, your heart rate goes up, and when you rest, your heart rate comes back down again. Your heart also has its own circulatory system that's called a coronary circulation, that carries the nutrients and the waste products away from the cardiac muscle within the heart. The second part of the cardiovascular system is the blood itself. The blood is the connective tissue, and adults will have approximately 4 to 5 litres of blood in their body. And the components of the blood include the plasma, which accounts for about 55% of the blood. It's a straw coloured fluid, slightly thick. You've got blood cells, like red blood cells, the erythrocytes, and they carry the oxygen. They bind to the oxygen, carry the oxygen around your body. You've got white blood cells. Those white blood cells, also known as leukocytes, they fight infection. And finally, we have the platelets, or the thrombocytes, which clot the blood. And the final component of the cardiovascular system are the blood vessels themselves. The blood vessels include the arteries, which are the thicker of all of the blood vessels. They carry blood away from the heart. Blood pressure within the arteries is quite high. Your arterioles, which are like small arteries, they carry blood from the arteries to the capillaries. And the capillaries is where the exchange of nutrients and gases takes place. Finally, the blood travels back to the heart via venules and veins. Now, venules and veins, quite similar. Venules are just small veins, and the veins themselves have very thin walls, and they have valves inside. Some people suffer from conditions like varicose veins because those valves don't work like they should. So a heartbeat, also known as the cardiac cycle, so it's a pattern of contraction of the heart. So that cardiac muscle that I mentioned before, it contracts. It's broken down into two parts. Systole is where the top two chambers, the atria, contract first, and blood gets pushed from the upper half of the heart into the lower half of the heart, into the ventricles. Then the ventricles contract, and the blood then gets pushed out of the heart. That's called systole. The second part is diastole, where the heart dilates and refills with blood once again. It's a cycle, hence it's called a cardiac cycle. Okay, so heart rate, definition of heart rate, is the number of heartbeats per minute. The average adult's resting heart rate is between 60 and 100 beats per minute. And some athletes, endurance athletes like marathon runners and so on, will have a very low resting heart rate, sometimes as low as 30 beats per minute. However, for some untrained individuals, a low resting heart rate may indicate an underlying health condition. Now, like I said before, your heart rate is controlled by your autonomic nervous system, and when you exercise, your heart rate goes up. When you rest, your heart rate goes down. It's just keeping homeostasis, keeping the muscles energized during a run or during a walk or whatever the case may be. Resting heart rate can be measured. Normally the best way to measure it would be to take your resting heart rate 3 mornings before you even get out of bed. And nowadays we have watches and we have heart rate monitors and so on, and we can just take that score, add it add those 3 scores together and divide it by 3, and that will give you your resting heart rate. So we can also take your pulse manually by using your index finger and your middle finger by pressing on the radial artery here at the wrist or the carotid artery here at the neck. And again, just take that pulse for a minute, and that will be your resting heart rate. Another term that you might come across is the maximum heart rate, and that is exactly what it is. It's the maximum heart rate that your heart can reach during a maximal exercise bout. Not very nice thing to have done. You have to go to your maximum to get your maximum heart rate, but we can also use a formula, very simple formula, 220 minus your age. So if you're 20 years of age, in theory, your resting heart rate, your maximum heart rate is at 200 beats per minute, but it's not very accurate. And you can take from that as we get older, our maximum heart rate goes down. It's a natural occurrence. The definition of blood pressure is that it's the pressure or the force that the blood exerts on the walls of your arteries as it is transmitted from your heart. There are many causes to high blood pressure, including stress, narrowing and hardening of the arteries. So hypertension is another name for high blood pressure, and it increases the risk of heart failure, stroke and dementia. Blood pressure can be managed in a number of different ways: medication, lifestyle changes like diet and exercise. And blood pressure can be measured by using a device like this. This is a very basic device, and you can buy these in any store, and you can measure your own blood pressure. Failing that, just talk to a medical professional, your pharmacist or so on, and they can measure it there. It's estimated that about 50% of people in Ireland over the age of 45 have high blood pressure, and the thing is, there are no symptoms, and hypertension is often called a silent killer. Adults over the age of 40 are advised to have their blood pressure checked at least once annually. So the good news is that exercise has a positive effect on your cardiovascular system. It strengthens the heart muscle, the cardiac muscle. It lowers your blood pressure. It can improve your cholesterol levels. It can increase your blood vessel flexibility, among many others. And these together then will reduce the risk of heart disease and improve overall cardiovascular function by making the heart more efficient at pumping the blood around your body. Okay, so again, if you remember from the first video, we talked about fit principles, and any fitness professional will use a set of guidelines in order to improve one's cardiovascular fitness or cardiorespiratory fitness. So again, those fit principles, the F stands for frequency. So one would or should exercise somewhere between 3 and 5 days per week. The I in fit stands for the intensity. So a beginner might start at about 55% of their maximum heart rate. Remember, we worked that out before. 220 minus your age is the maximum. So we work at a percentage of that from 55% if you're a beginner up to 85% if you're a more seasoned trainer. The time then, the T, there's 2 T's in fit. The time would be minimum 20 minutes up to an hour plus. And finally, the type of exercise that you would do would include running, cycling, swimming, basically any exercise that brings your heart rate into that training zone that I just mentioned.